Let's go to visual diagnosis inspection, and the topic is uncontrolled movement and stiffness of tongue. There should be flexibility and movement in the tongue. If the tongue movements are involuntary, this may be interior wind causing qi to move chaotically or the spleen failing to control the muscles. When the spleen does not control the muscles in the tongue can quiver. Sometimes the tongue will begin to quiver after the person has had their tongue extended for a few seconds. It is as if the spleen is no longer capable of keeping the tongue still. In the same way that a light wind will cause a flag to wave from side to side, high winds will make the cloth of a flag hard and stiff. The same applies to the tongue. Interior wind can make the tongue sway from side to side or result in a tongue that is rigid and inflexible. If the tongue deviates to one side, this can be due to the channels on one side of the body being excess wind or phlegm, or the channels on the other side of the body being deficient. A flaccid tongue, especially if it is swollen, it indicates qi deficiency or phlegm. The moving tongue moves slowly from side to side with large amplitude movements when it is extended, and the patient cannot control its movement. It always indicates internal wind and is usually seen in the elderly. The quivering tongue trembles rapidly with small amplitude movements as it is extended. The most common clinical significance of a quivering tongue in chronic conditions is spleen qi or spleen yang deficiency. The quivering tongue trembles rapidly and with small amplitude, and the quivering tongue generally indicates spleen deficiency, and occasionally in the elderly it may indicate internal wind. And for a moving tongue, it moves slowly from side to side as the patient sticks it out. This movement is involuntary and the patient is not aware of it. So here, just a summary, a quivering tongue is spleen qi deficiency. It's rapid trembling with a small amplitude. And the moving tongue is internal wind. It will be slow, side-to-side movement with a large amplitude. The stiff tongue is inflexible, making it difficult to move or turn. It causes slurred speech and makes it difficult to take in food. So let's look at what the stiff tongue indicates. One of the indications is external heat invades the pericardium, where the tongue body will be crimson and the coating will be yellow. And the pathogenesis for this is excess heat exhausts body fluids, leading to tongue's malnutrition. Another indication is internal wind, and the tongue body will be slightly red or green-purple, and the tongue coating will be varied. The pathogenesis for internal wind is liver dysfunction gives rise to wind, leading to spasm of the tongue. And another indication is turbid phlegm, where the tongue body will be flabby and the coating will be thick and greasy. And the pathogenesis is phlegm obstructs qi and blood, leading to tongue's malnutrition. The stiff tongue indicates a tongue that is stiff and hard. The stiff tongue has three possible clinical meanings. It's internal wind, number 2 is blood stasis, and 3 is yin deficiency. As indicated above, a change in body shape indicates a more severe condition, compared to one in which there is a change only in the body color. For instance, a purple tongue indicates blood stasis, and if it is also stiff, it indicates that the blood stasis is severe. So here we can see a picture of a stiff, hard tongue, which is caused by internal wind, blood stasis, and yin deficiency. Under normal circumstances, the tongue should be stable, without trembling, quivering, involuntary, or uncontrolled movements. It should have symmetry without deviation. And let's look at the pathomechanisms of abnormal movements of the tongue. Spasms of the sinews and muscles cause abnormal movements of the tongue. The liver controls the sinews and the spleen controls the muscles. So spasms can be caused either by internal wind, which is often due to hyperactivity of the liver, internal excessive heat, or by malnutrition due to insufficient qi, blood, or body fluids. So here is a diagram of the pathomechanism of normal states of the tongue. So when the qi, blood, and body fluids nourish the tongue, there is normal movement. When there's internal wind and lack of nutrition, the tendon spasms and the tongue will start to tremble. And when there's heat in the heart or spleen channels, there will be oral discomfort and the tongue will be protruding and licking. And when there's wind or phlegm, the qi and blood will flow unilaterally blocked in collaterals, so the tongue will become deviated. So let's look at the trembling or quivering tongue. When the tongue is extended or retracted, the tongue body shivers or quivers uncontrollably. One of the indications of a trembling tongue is deficiency of qi and blood or yang depletion that causes body fluid impairment. The tongue body will be pale or pale and limp, and the pathogenesis is qi and blood or yang deficiency fails to nourish the tongue. Another indication is internal wind due to extreme pathogenic heat, where the tongue body will be red and dry. And another one is alcohol intoxication, where the tongue body will be deep red and swollen. And the pathogenesis for those two indications is internal pathogenic heat gives rise to internal wind and injures body fluids which fail to nourish and moisten the tongue's tendon and muscle. Thank you so much for your attention.